All right, let's get right into it. In this explainer, we're going to break down a really important 2025 paper from Souza and his team. They did a deep dive on focused ultrasound, which you'll see called tFUS, and how it's shaping up to be a new therapy for some of the toughest neuropsychiatric disorders out there. So let's jump in.
So before we even get into the tech, we have to ask, what's the problem we're trying to solve here? And it's a big one. It's all about treatment resistance in psychiatry, which is a massive clinical hurdle.
Okay, so here's the fundamental challenge. You have a huge number of patients who just don't get better with standard treatments, like medication or therapy. The next option? Well, historically, it's been things like deep brain stimulation. We're talking about invasive surgery, drilling into the skull. But now, focused ultrasound comes into the picture as a potential game changer. Why? Because it's completely non-invasive. It can deliver energy right through the skull with incredible precision. And you get to sidestep all those major risks that come with open surgery, like infection or bleeding.
Okay, so how does this whole thing actually work? Well, the first thing to get is that focused ultrasound isn't just one thing. It actually has two very different ways of working. Let's look at the two modes, ablation versus neuromodulation.
So on one side, you've got high-intensity focused ultrasound, or HIFU. Think of this as the power setting. We're talking high energy, over 100 watts per square centimeter. What it does is it literally heats up a tiny, precise spot of tissue, creating a permanent lesion. It's a surgical tool. Then you have the other side, low-intensity focused ultrasound, or LIFU. This is way lower energy, less than 3 watts. Instead of heat, it uses mechanical vibration to kind of nudge the neurons. This creates a temporary effect, either exciting or inhibiting them, but it doesn't cause any permanent damage.
And this visual really drives that point home. HIFU on the left, that's your sonic scalpel. It's making a permanent structural change. It's an ablation. But LIFU on the right, that's more like a remote control for your brain circuits. It's creating a temporary functional change, a modulation. And honestly, understanding this distinction is key, because which one you choose completely changes the entire treatment strategy.
Okay, so now that we have the basics of the technology down, let's get to the really interesting part, the clinical results. What does the evidence actually say for different disorders? This is the heart of the review. All right, first up, obsessive compulsive disorder, or OCD. It's actually one of the very first conditions where this technology was tested. For those really tough, treatment-resistant cases of OCD, the high-intensity approach, HIFU, has been showing some really promising results. The main target they're going after is a specific spot in the brain called the anterior limb of the internal capsule. Now, what do the numbers say? Early studies showed about a 33% improvement in symptoms, but then a later study reported a response rate of nearly 67%. And here's the really critical part. Those improvements held up 2 years later. That tells us this isn't just a temporary fix, it's durable. Okay, so that's the high-intensity story. But what about the low-intensity neuromodulation approach for OCD? Well, a pilot study from 2023 looked into this, and the results are pretty fascinating because it's a tale of two targets. When they aimed for the ventral striatum, they saw a 70% meaningful response rate. Pretty great, right? But when they tried to target a different area, the caudate nucleus, it just didn't work out. Too many people dropped out and they had to stop. It's a perfect example of how hitting the exact right spot is everything for this therapy to work.
All right, moving on from OCD, let's look at the data for major depressive disorder, another really challenging condition where treatment resistance is a huge problem.
Now, for MDD, the results for the high-intensity ablation technique are, well, a bit more modest. There was the Sunnybrook trial, a small study with just 6 patients that found a 33% response rate. So the effectiveness wasn't off the charts, but, and this is a big but, the main takeaway was its safety. There were no serious adverse events, and in this kind of early-stage research, proving safety is an absolutely critical first hurdle to clear. But then you look at the low-intensity neuromodulation side for MDD, and the story gets a lot more compelling. A really well-designed study from 2024, we're talking randomized, double-blind, sham-controlled, the gold standard, targeted the dorsolateral prefrontal cortex. And what did they find? A statistically significant drop in depressive symptoms compared to the fake procedure. Even better, they backed this up with hard data from fMRI scans showing that the treatment actually increased connectivity in key brain circuits. That's a huge deal.
Okay, next up, let's talk about generalized anxiety disorder, or GAD.
There's one number that really stands out from the main study here, 64%. So what's behind that number?
So that 64%,
That's the percentage of patients with treatment-resistant GAD who saw significant clinical improvement in a 2023 study. What the researchers did was use the low-intensity tFUS to modulate the right amygdala over an 8-week period. And maybe just as important as the high response rate, they did it with 0 adverse events reported. That's a really impressive combination of efficacy and safety.
The research on substance use disorder is still in its early days, but wow, the initial results are incredibly encouraging. Take this 2023 study on opioid use disorder. It was small, but they targeted the nucleus accumbens. That's a core part of the brain's reward system. And the result? It was pretty remarkable. 4 out of the 5 patients, that's 80%, were completely abstinent 90 days after the treatment. That's a number that makes you sit up and pay attention.
And one more area to look at, schizophrenia. Specifically, they looked at the negative symptoms, things like social withdrawal and the inability to feel pleasure, which are notoriously hard to treat with just medication. A 2023 sham-controlled study targeted the dorsolateral prefrontal cortex, and they found a highly significant reduction in those negative symptoms. On top of that, patients' cognitive performance also got better. That's a really important finding for such a challenging aspect of the illness.
Okay, so we've seen a lot of promising results. It's easy to get excited. But it's also really important to take a step back and look at this critically, which is exactly what the review paper does. So, what are the limitations here?
The paper really highlights 4 big challenges facing the field right now. First is just heterogeneity. One study targets this brain area with this protocol, another study does something completely different. It makes it really hard to compare apples to apples. Second, and this is a big one, is sample size. Most of what we've just talked about comes from small, early-stage studies. Third, there's a durability gap. We know the high-intensity ablation is permanent, but for the low-intensity stuff, we just don't have a lot of long-term data yet on how long the effects last. And finally, precision. Right now, a lot of the targets are still pretty broad anatomical regions, not the fine-tuned, personalized neural circuits we'd eventually want to target.
So, with all that in mind, what's next? Where does the research need to go from here? Let's wrap up by looking at the future directions and pulling out the main take-home messages.
The authors lay out a really clear 4-step roadmap for the future. It all starts with number 1, standardization. Everyone needs to get on the same page with protocols. Once that's in place, you can move to step 2, precision targeting, really zeroing in on specific neural circuits. Step 3 is about leveling up the study design. We need to move beyond small pilots to large-scale multi-center randomized trials. And finally, step 4 is looking into combined therapy. Think about using tFUS to temporarily open the blood-brain barrier to get medications to the brain more effectively. It's a really exciting possibility.
Okay, let's distill this all down to the absolute must-know points. First, focused ultrasound is a very real emerging option for treatment-resistant disorders, and across the board, it seems to have a great safety profile. Second, you have to remember that the mechanism is everything. HIFU is permanent ablation. LAFU is temporary, tunable neuromodulation. 2 totally different tools for different jobs.
Third, if you're asking where is the evidence strongest right now, the answer is for OCD with the high-intensity approach and for anxiety with the low-intensity approach. And the final and maybe most important takeaway is about the future. The entire path to this becoming a standard treatment hinges on that one word, standardization. Without standardized protocols, the field just can't move forward to widespread clinical use. And that really leaves us with the big question, doesn't it? The research is moving fast, the potential is obviously there, but how does the entire field come together to standardize these protocols and targets? Because that's the bridge they have to cross to take focused ultrasound from being this incredibly promising therapy in the lab to a standard of care that can actually help the patients who need it most.